The Illinois National Guard has had over almost 27 years in this state partnership program with Poland, and we've looked at a lot of different aspects of this relationship. We started out really with NCO development and went into exercises and key leader engagements, but this one's really unique. This medical team coming from Poland to share their specialties and skills. It's a different perspective, and we're as highlighted yesterday in the call with the Pentagon, we're really the first partnership to have this kind of engagement where we have the country that we're in the partnership with actually come to the U.S. and help out in a particular situation. So this is, I think, is unique, and I think it helps build our relationship. Poland's an incredible country, and it's grown, from our initial engagement in 1993, has just grown in incredible leaps and bounds. It's a technology hub. It's a very powerful country that's very well educated and very capable. And if anyone has been around long enough to watch this growth from when they first emerged behind the Iron Curtain, it's just an amazing story. And so this really opens another chapter. Now, what was the engagement? There was engagement with the military medical professionals, but really there was a huge engagement with the community. And I think that's where our community really benefited from understanding some techniques and things that they had seen from the Polish perspective. The Poles had really brought the European understanding on practicing medicine and how to address this COVID-19 challenge. And it was interesting to hear the differences between what we're doing here in the U.S. and what is happening in Europe, Poland and Italy, as they have the perspective from those two areas.
But this team is very unique because they were in Italy, so they have not only the Polish perspective, but they have the Italian perspective. They went there in a peak of the disease, so they saw, very difficult situation to cope with just because of the number of the assets available for a civilian system. So that's why we thought that it will be much more beneficial just to meet the people who have pretty much very unique experience from Italy and Poland. So there is of course, there is a few things which we do differently in Poland due to other, health system. So when we visit that emergency operation center, Kukanti, we're surprised how many people work with, how many data they collect with, of course, with the support of the National Guard staff. But we were surprised how effective this team could be in such kind of, the threat or challenge. So that was very interesting for all these people who usually they are physicians or working in a hospital, but the whole system which provide the information for them in a decision-making process, it's a very, very important to set up everything correctly, depends on the threat or depends on the challenge. But of course, we talk about the McCormick, which is just unbelievable facility, and we don't do such kind of the big field hospital in Poland. So, that's kind of the experience that, yes, we can do so many, beds in a short time, but we just probably have to, work a little bit differently than we did in the past, just building the field hospital like in the military. The military does it with the tents, thousands of, military equipment to put in to set it up and operate. But I think that the most important part is discussion with the local physicians, local hospitals, how they handle with the COVID-19, and actually how they operate in such kind of the threat for the staff, for the personnel, and for the patients. Well, without the National Guard support, this visit wouldn't happen. There was no way. So I'm very pleased, I'm happy that National Guard support us, Polish military again, and you allow us to be effective here.
I'm Captain Jacek Siewiera. I'm a physician, anesthesiologist, and commander of this Polish medical military mission in United States. So the team consists of 9 people, 4 of them are doctors and 5 are nurses and EMT technicians. This mission is an effect of nearly 30 years of cooperation between the Illinois National Guard and Polish military. This visit here, in these very dark times, was the light of hope for me and for my team that we can improve and get the world better by cooperating with our allies, with National Guard of Illinois. From here we will take a lot of experience, but what I see the huge difference and what makes the difference between European approach and US approach, especially the National Guard of Illinois, is the data-driven decision-making and how Army can support the decision-making process. So collecting the data with a good quality of data, with a good number of it, and appropriate frequency is the most impressive part of your job. So how you collect the data from the hospitals about the PPE, about the resources, about the personnel, about the number of patients, number of beds, number of ventilators. That looks very impressive, and we have to implement how this process is going on. We admire your expertise and experience, your qualifications, and we see that this respect is going reversely. So we know that this is not just about the cooperation, but I believe, I'm nearly sure that we will continue to cooperate and to exchange experiences on every level of our specialists, on every level of our structures. In Poland, we've got a saying that the best friends we meet in the worst times. And probably that's one of the situations like this. So we are here as your friends, and I am sure that only by staying together we can fight with this threat. I am sure that we have to cooperate against any other enemy exactly the same way. And the scale is only the question of what the threat will be. That's the real partnership.
I really believe that Poland and Illinois' relationship is the best of all the state partnerships. And we've really grown to be friends over the years. And that's what I'm really proud of, is the friendships that we've built over the years. And it's just amazing to see how the Polish military just continue to mature and grow and develop. And it really has a little bit of American flavor, a little bit of National Guard flavor on it. And very proud to see that. And in this kind of response, we have to look at how other countries are approaching these issues and see what are the ways that we might be able to, in America, maybe take a European solution and make it fit in the US to help solve these problems. And I think it could be an area that we continue to explore in the future, a line of effort that we would develop and look to in the future. This medical team, they're the best. I mean, they're really capable. They're not just all military, they're military and civilians, doctors, EMTs, and nurses, and they all bring some unique capabilities and very much an interest in continuing this engagement. So we're looking for ways that we can continue to build this partnership. And I believe we'll hear from the National Guard Bureau and other states to say, hey, how'd you do that with Poland? We'd like to remodel that in the future and try that as well.